Hello everyone. Today let us discuss about recent and high yield updated LMRPs of biochemistry. Reactions taking place in mitochondria are Krebs cycle, urea cycle, electron transfer and fatty acid cycle. Melatonin is synthesized from tryptophan. Amino acids excreted in the urine in cystinosis is cysteine, ornithine, arginine and lysine. In maple syrup urine disease, the amino acids excreted in the urine are leucine, isoleucine, and valine. Vitamin necessary for post-transitional modification is vitamin K. Decarboxylation needs vitamin B6. Fatty acid not synthesized in the body is linoleic acid. Albinism results from deficiency of tyrosinase. Abnormal urinary constituents are albumin, ketone, glucose. Polyuria is seen in diabetes mellitus, diabetes insipidus, recovery from acute nephritis. Physiological constituents of urine, urea and creatinine. Major site of action of insulin, muscle, adipose tissue and liver. Semi-essential amino acids are arginine, histidine. Ratio of adrenaline to noradrenaline is 85 is to 15. Acidic amino acids are asparagine and glutamine. Basic amino acids are arginine, lysine. Aromatic amino acids are tryptophan, tyrosine and phenylalanine. Total body iodine stores are about 50 mg. Vitamin C is present in largest amount in the body in adrenal cortex. Tetany can be caused by hypocalcemia, hypomagnesemia. Bile acids are derived from cholesterol, which is completely dependent on glucose as fuel is retina. Immediate precursor of norepinephrine is dopamine. Uric acid levels are increased in preeclampsia, Hodgkin's lymphoma and leukemia. Metals in B12, vitamin B12 is cobalt. Ammonia in the brain is converted into glutamine. Dopamine synthesis in brain is increased by carbidopa. Calcium binding protein is troponin C. Metabolite of epinephrine is metanephrine. End product of purine metabolism is uric acid. Vitamin A overdosage causes injury to lysosomes. Myocardium normally utilizes fatty acid. Maximum amount of serum cholesterol is found in LDL. Vitamin that is useful in cancer is vitamin A. Enzyme acetylcholine. Urea in the brain is derived from glutamine. Cholesterol from the liver is transported to the tissues mainly by the VLDL. Precursors of steroid, cholesterol. Maple syrup urine disease is due to the deficiency of decarboxylation. Amino acid that can be converted into vitamin is tryptophan. Main function of mitochondria is electron transfer. Histamine is produced by decarboxylation. Ketone body formation takes place in liver. Xanthurenic acid is a product of metabolism of tryptophan. Hemorrhagic disease of newborn is seen due to the deficiency of vitamin K. Acrodermatitis enteropathica is due to zinc deficiency. Molybdenum is necessary for xanthan oxidase. Heart nerve disease is due to deficiency of tryptophan. Vitamin used to correct neurological symptoms is cyanocobalamin B12. Wernicke-Korsakoff psychosis or beriberi caused by deficiency of thiamine B1. Burning food syndrome is caused by deficiency of pantothenic acid. Megaloblastic anemia or neural tube defects caused by deficiency of folic acid. Pernicious anemia caused by deficiency of vitamin B12. Seborrheic dermatitis caused by deficiency of riboflavin B2. IHD is associated with which type of cholesterol? LDL. Seen in chronic starvation. Insulin decreases, glucagon and growth hormone increases, free fatty acid increases, glucose tolerance decreases. Southern blot test is used to detect DNA. Northern blot test is for RNA. Western blot test is for protein. Wernicke's encephalopathy is caused by deficiency of B1. Vitamin K dependent clotting factors are factor 2, 7, 9 and 10. Enzyme deficient in Marfan syndrome is lysyl oxidase. Sulfur-containing amino acids, cysteine and methionine. In Hartnupp's disease, excreted in the urine is tryptophan. Bile contains cholic acid, chenodeoxycholic acid, deoxycholic and lithocholic acids. Cofactor for transamination is pyridoxine. Vitamin essential for transamination is B6. Phenylpyruvic acid in the urine is detected by Guthrie's test. In alkaptonuria, the urine contains homogentisic acid. Insulin has 51 amino acids. Von Gerke's disease is due to deficiency of galactose 1 phosphate uridyl transferase. Essential fatty acids are linoleic acid, linolenic acid, and arachidonic acid. Iron is absorbed. Vitamin B12 is absorbed in the terminal ileum. Highest content of triglycerides is seen in kilomicrons. Atherosclerosis is due to apoprotein E deficiency. Triglyceride synthesis is increased by insulin. Essential amino acid phenylalanine, lysine and leucine. Insulin acts on which enzyme in glycolysis? Glucokinase. Present in cerebroside, sphingosine and galactose. Melatonin is derived from tryptophan. Liver produces albumin, fibrinogen, prothrombin and not gamma globulin. Bile acids are formed from cholesterol. Heme in hemoglobin is in the hydrophobic pocket. 17 alpha hydroxylase deficiency causes decreased testosterone. Substance that does not cross blood-brain barrier is insulin. Anti-infective vitamin is vitamin A1. Tissue with highest glycogen content is liver. Detoxification of drugs is controlled by cytochrome P450. Anti-atherosclerotic lipoprotein is HDL. Most common enzyme deficiency in man is glucose 6-phosphate dehydrogenase. Largest amounts of prostaglandins are seen in seminal fluids. Sulfonamides are conjugated by glucuronic acid. Which amino acid causes hypoglycemia? Leucine. Vitamin present in coenzyme A is pantothenic acid. Insulin resistance is seen in hypothyroidism, acromegaly. DNA double helix is bound by hydrogen bond. Glucose 6-phosphate dehydrogenase deficiency is seen in von Gerke's disease. Muscle glycogen is mainly used for supplying energy to heart. Enzyme marker of electron transport system is cytochrome reductase. Major contribution towards gluconeogenesis is by alanine. Conversion of prothrombin to thrombin requires factors 7, 10, 5 and calcium, which does not inhibit platelet aggregation is thromboxane A2. Conversion of proline to hydroxyproline is by vitamin C mediated hydroxylation. Ketone body which is maximum in DKA is acetoacetic acid. Biotin is essential for carboxylation. Ketoacidosis without glycosuria is seen in prolonged starvation. Protein synthesis takes place in endoplasmic reticulum. NADPH is required in lipogenesis. Dietary fiber is rich in pectin. Lipid which accumulates in fatty liver is triglycerides. Gluconeogenesis occurs in the liver and kidney. Germ oil has high content of vitamin E. Melanin is synthesized from phenylalanine. Obesity is associated with decreased insulin response. Glycerol is converted to glucose in liver. Vitamin K plays an essential role in biosynthesis of prothrombin and proconvertin. Preservative used in urine sample for chemical analysis is thymol. Heart muscle in comparison to skeletal muscle has high carnosine. pH of normal sweat is 4.5. Urea is mainly formed in liver and to a small extent in brain. Glutamine is the sole form of transport of ammonia in brain. In metabolic alkalosis, there is decreased ammonia excretion in urine. Urea cycle is the first metabolic cycle to be elucidated by Hans Krebs and Kurt Hensleit. Kidney and intestine possess all the urea cycle enzymes except arginase. Carbamyl phosphate synthetase 1 is the rate limiting enzyme of urea cycle. Synthesis of 1 mole urea requires 3 moles ATP. Ornithine transcarbamylase deficiency is the most common urea cycle disorder. All urea cycle disorders are autosomal recessive except hyperammonemia type 2, ornithine transcarbamylase deficiency. Triple H syndrome, hyperornithemia, hyperammonemia, homocitrullinuria due to mutation in ORNT1 gene. Mutation in ornithine aminotransferase causes gyrate atrophy of retina. Arginosuccinic acidemia produces trichorexis nodosa. Heme is synthesized from succinyl-CoA and glycine. ALA synthase is the rate-limiting enzyme of heme synthesis. Synthesis of ALA occurs in mitochondria. High levels of lead can inhibit the enzymes ALA synthase, ferrochelatase, and ALA dehydratase. Porphobilinogen is the first precursor of heme with a ring structure. Site of heme synthesis is liver and bone marrow. Porphyria cutanea tarda is the most common type of porphyria. All porphyrias are autosomal dominant except congenital erythropoietic porphyria, which is autosomal recessive. Acute intermittent porphyria is caused by deficiency of uroporphyrinogen 1 synthase and presents with abdominal pain and neuropsychiatric symptoms. Activator of LCAT, ApoA1. Activator of extrahepatic lipoprotein lipase is ApoC2. Arginine-rich lipoprotein is ApoE. ApoE4 binds avidly to beta amyloid in neuritic plaques of Alzheimer's disease. Apoprotein for chylomicrons only. ApoB48. Common apoprotein of VLDL, LDL and IDL is ApoB100. ApoA shows structural homologies to plasminogen. Triglycerides are normal only in type 2. Cholesterol is increased only in type 2 and type 3. Both the cholesterol and triglycerides are increased in type 3. In A beta lipoproteinemia, early death can be avoided by fat soluble vitamins, especially vitamin E. In Tanger's disease and Fisheye disease, there is low or near absence of HDL. Jamaican vomiting sickness from eating of unripe fruits of ackee tree. Scurvy is the first disease identified due to dietary deficiency. Vitamin C supplementation is useful in Chidiac-Higashi syndrome and osteogenesis imperfecta. Vitamin whose deficiency and excess produces myopathy is vitamin E. Heat labile vitamins are vitamin C and folic acid. Refractory hypochromic anemia, neutropenia, osteopenia, defective keratinization, and pigmentation of hair is a feature of copper deficiency. Chromium deficiency can produce impaired glucose tolerance. Zinc deficiency is associated with diarrhea, poor wound healing, immune dysfunction, and hypogonadism. Selenium deficiency produces Cation disease, endemic cardiomyopathy, and Cation-Beck disease, endemic osteoarthritis. Ouch ouch or itai disease is due to toxicity of cadmium. All the enzymes for glycolysis are present in cytosol. Glycolysis is the only pathway that is taking place in all cells of the body. Rate limiting step in glycolysis is the one catalyzed by phosphofructokinase 1. Essential pentosuria occurs due to deficiency of xylitol dehydrogenase or xylulose reductase. 1 mole of NADH yields 2.5 ATP, whereas 1 mole of FADH yields 1.5 ATP. Enzymes don't alter the energy of reaction but lower the energy of activation. Vmax, maximum velocity with specified amount of enzyme. Km, concentration of substrate required to produce half Vmax. Enzyme activity is measured as micromoles per minute. Low Km reflects high affinity of enzyme. If cells are irradiated in G1 phase, chromosomal abnormalities may occur. If cells are irradiated in G2 phase, chromosomal aberrations may occur. Most common form of provitamin A is beta carotene. Required for activation of factor 8 is not true regarding vitamin K. LDH flip in myocardial infarction is LDH1 more than LDH2. Most common product of fatty acid synthesis is palmitic acid. Nitric oxide works by cyclic GMP. Tyrosinosis is probably caused due to the defect in fumarate acetoacetate hydrolase enzyme. Galactosemia is most commonly caused due to defect in GALT uridyl transferase. True about DNA polymerase 1 is it does proofreading and repair. Function of chaperone is protein folding. Color blindness is the X-linked disorder. Cysteine is the amino acid which is not lost in cystinuria. Negative charge carrying amino acid are glutamic acid and aspartic acid. Allosteric inhibitor acts on site other than enzymatic site to inhibit enzyme. In fish odor disease, the vitamin intake is restricted is choline. True about phenylketonuria is it usually diagnosed before 1 month of age. pKa of a drug is equal to the pH when equal amount of drug is ionized and non-ionized. Ketone bodies cannot be utilized by RBC. Methylation of cytosine is associated with decreased expression of gene. Clinau fragment lacks the activity of 5' to 3' exonuclease. Techniques based on RNA is RT-PCR, NASBA. tRNA of alanine does not require 5' capping. Methylation does not favor permissive euchromatin due to changes occurring at cytosine residues at CPG islands in DNA. A middle-aged woman presents with fissures in mouth, tingling sensation, and peripheral neuropathy. Investigations showed reduced glutathione reductase activity. The vitamin deficiency is the likely cause of this is vitamin B2. Fe absorption increases by vitamin C. The enzyme activity decreases in fasting is phosphofructokinase 1. An adolescent male patient came with pain in calf muscles on exercise. On biopsy, excessive amount of normal glycogen was found to be present in the muscle. The most likely enzyme deficiency is phosphorylase enzyme. Fluoride released from fluoroacetate inhibits the metabolic pathway is ETC by chelating calcium. Vitamin K in its coenzyme form is regenerated by epoxide reductase enzyme. Best investigation for metabolic disorders is tandem mass spectrometry. Best method to measure HbA1c is ion exchange chromatography. In Menkes disease, lysyl oxidase activity is reduced. After fatty meal, LPL deficient elevated is chylomicron. The amino acid producing nitric oxide is arginine. Ammonia toxicity with urea cycle due to depletion of norepinephrine to epinephrine conversion requires methionine in the form of SAM. Cardiac failure cause vitamin B1 deficiency. High glutamate in deficiency of CPS1. Mitochondrial DNA too is maternally inherited. Liver does not produce immunoglobulins. Not a ribozyme is poly A polymerase. Amino acid linking Krebs cycle and urea cycle is aspartate. Type 1 diabetes mellitus is true in increased lipolysis. Vitamin facilitates absorption of iron is vitamin C. The respiratory quotient for a person on exclusively carbohydrate diet is 1. The non-competitive antagonism Vmax decreases. In cerebrohepatorenal syndrome, the accumulate in brain is due to very long chain fatty acid. Patient is with type 1 diabetes mellitus with complaints of polyuria. Increased conversion of fatty acid to acetyl CoA will occur normally in his body. Method of transport of glucose in the intestine is secondary active transport. During exercise, most rapid way to synthesize ATP is phosphocreatine. At physiologic pH, the side chains of lysine and arginine are fully ionized and positively charged. Thank you. If you like this video, please do watch, like, share and subscribe.